So in this video, I wanted to go over jawline contouring. How do we get a jawline for days? How does it look amazing as well as being balanced, make us look youthful, and also make us look like we've lost weight? Because those are overall effects of strengthening the jawline. So when we're looking at that, there's a couple things we want to evaluate, and that is it a skin problem? Is it a muscle problem? Is it a fat problem? Or is it an underlying skeletal or bony problem? So once we figure all that out, we'll know exactly what type of procedures we can do to augment and make the jawline stronger. So when we're looking at the skin, is the skin loose and hanging, it's obviously going to obscure the jawline and you're not going to see a nice angle to the jawline. And the way to treat the skin problems are to use some sort of non-surgical skin tightening technique such as radio frequency devices. There's also radio frequency combined with microneedling. And all of those devices are aimed at improving elastin and collagen in your skin to tighten it up and give you a more angular jawline. Now, the next thing you want to look at is the muscles in the neck. Some people notice if you see in the neck these neck bands or bands coming down the middle of the neck, and that's called the platysma muscle, or the muscle that makes you do that when you scrunch up your neck. And when that muscle becomes weakened or dropped, we get neck bands. So there is a surgery called a neck lift where we go in and tighten those muscles up and lift the neck. And in that procedure, again, we're structuring that angular contour to the jawline. The next thing we want to look at, is it a fat problem? And that's better well known as a double chin. So if we have fat under our chin and it hangs down here, we're going to get what's called a double chin. And there's a couple ways to address that now. Non-surgically, you can do something called Kybella, which is an enzyme actually from our gallbladder, believe it or not. Not your gallbladder, but it's been isolated. And you can inject that in the chin and it dissolves the fat. Now that comes with a little bit of swelling and a little bit of downtime. So it's one of those procedures that you also have to possibly repeat. So the good part of it is that it's non-surgical. The bad part is that you may have to do multiple procedures and it comes with a little bit of swelling. In the past we did cool sculpting, other things in that area, but I think a lot more people are leaning towards the Kybella at this point. Next is a surgical way to treat that, which is traditional liposuction. We go in and liposuction that fat out of there to get that neck to snack back up and give you a nice angle to your jawline. Now, the first part I mentioned skin as well, so there's ways that you can combine all of these things together. So you can treat liposuction to get the double chin away, you can do skin tightening afterwards to get that skin to tighten up, and then there's ways you can also tighten the muscles. So you can combine all three depending on what you need. If you have a skin problem, muscle problem, and a fat problem, we combine all three. The next thing is if you have a skeletal problem. That means, is your bone or is your chin itself back? And in that case, the way to augment that is to traditionally use what's called a chin implant, which we insert from inside the mouth and put in the chin to augment the bone itself. Now, these chin implants are permanent. You don't need to replace them, and they sit right on the chin. They don't move, and it's not a very painful procedure. The only other way you can possibly substitute for a chin implant is to use facial fillers and or fat grafting. You can use fat grafting to augment the chin and also contour that jawline. As well as a lot of people now, or if we have a little bit of a jowl or a pre-jowl sulcus here, you can use fat to fill in these areas and augment the angle of the jaw to again give you that nice long jawline. And the chin. So you can add all these together, or if there's only a particular area that's bothering you, you can do one of the procedures isolated. Lastly, there's one thing that's coming up more recently called threading. So threading is something you can do in the neck as well, and that's taking some barbed sutures or threads that are inserted into the neck to pull on the skin and muscles itself. Secondly, you can use it to bring up the jaw. So threading is again a daytime procedure in a spa, and they're not permanent. They used to be a permanent suture, and the problem with those is over time they could break, they could have problems. So the newer ones have switched to dissolvable threads, and those last anywhere from about 6 months to 9 months. And there are different strengths, so some of them can last longer, some of them dissolve faster. And the good news is, if you didn't like the result of the threading, you can dissolve them with radio frequency. So overall, the procedures, you can combine all of these things together, or you can pick one and see if you like the results from a single one of them. Simple things like facial fillers can be extremely powerful, at least as an introductory to your jawline. In other words, if you have a chin that's recessed or weak, you can strengthen that chin. You can fill in contour deformities in the jawline to give a nice, smooth, long jawline. And then particularly in the back or the angle of the jaw here, there's one of two things that happen. Some people, because of grinding or biting down, they have very strong masseters, actually too big. Now you can shrink those with botox to bring them into line, And if they're too small and you want a stronger angle, again, you can augment that with fillers. And the only thing I want to make sure people understand about that is if you like the fillers and they're doing what you want, but you're getting tired of repeating, going back to have to do more and more fillers because they're dissolving and repeating and doing more fillers and it's getting expensive, the next option is to replace that with fat grafting. So if you like the results you're getting with the fillers, you're gonna love the results you get with the fat grafting because it's gonna last longer and it's slightly more powerful than the fillers. Now that I've gone over the different procedures you can do to augment your jawline, I wanted to talk a little bit about the recovery because there's slightly different recoveries for the procedures, whether they're non-surgical or surgical. If you're looking at the treatments for the neck, which are the skin tightening treatments, there's very little downtime with these procedures. You might be a little bit red or a little bit sore for a day or two, but it's nothing that's gonna knock you down for a long period of time. Doing the neck lift and tightening those muscles in your neck obviously comes with a little bit more downtime because it is a surgical procedure. You'll be a little bit swollen or bruised in the neck for at least a week. As far as pain, it's not a painful procedure, but you do have a little bit more recovery than if you were just to do one of the skin treatments that are non-surgical. As far as the liposuction and the Kybella, I feel that they're pretty close, if not in fact that the Kybella may come with a little bit longer recovery because there's a lot more swelling that happens after that procedure and patients need to be aware of that. With the liposuction, there may be a little bit more bruising, but there is less swelling. Both of them, as far as post-op, are non-painful, but I do have to say that the Kybella burns a little bit. So if you're gonna be doing that chemical reaction in the neck from the Kybella, it does come with a lot of inflammation and a little bit of stinging when you inject that Kybella. With the lipo, there's none of that. There's just a little bit of bruising, a little bit of swelling, but it's essentially painless, or you might have a little bit of numbness in the neck for a week or two. As far as the chin implant, again, very fast recovery because it's put in from inside the mouth. There's not a long downtime. There's a little bit of tightness to the jaw, but you're back to normal eating with a day or two. This is not something that'll knock you down for weeks. The last thing is to talk about the threading in the face. Again, a daytime procedure. It does come with a little bit of downtime as far as feeling pulling in the face and a little bit of swelling in the face for a few days. So it is something that does come with a little bit of downtime, but not as much as one of the surgical procedures.
If you have any other questions, leave them in the comments below.
That's all, folks. What was that thing they used? No, we cried out. Well, I'm sorry. That's all I have to say about this. That's what I was saying.
Yeah, I mean, say whatever you want.
Oh man.
Uh-huh.
That's all, folks.
I have some great footage of you, yeah.
Oh, wonderful. So that's a general overview of jawline contouring. If you have any questions about any of the procedures I mentioned, go ahead and leave your questions in the comments below.